Osun Health Insurance Agency (OSHA) has paid over 1 billion in debt inherited by the new leadership of the agency to healthcare providers. The OSHA Executive Secretary, Dr. Razak Akindele, made this known on Monday during the agency annual performance review and strategy retreat held in Ada, Osun State. Akindele, who stated that the retreat was organized to evaluate their performance and project a way forward for the fiscal year, noted that the management and staff of the agency were extremely dedicated to the cause of the OSHA. While stating that clearing the debt was his priority, Dr. Akindele revealed that he met more than 1 billion in debt ranging from unpaid fees to healthcare service providers and 13 months of capitation owed to health centers.
Yeah, it's actually to evaluate what we have done in the past and see where we can go. We introduced a lot of activities during the last 1 year. So we want to review how successful these activities were and to also plan for this fiscal year. What I said was that I met more than a billion naira debt. It's not deficit. Okay. I said debt, and I have to clear all the debt. It ranges from money that were owed health facilities in terms of the fee for service that they are supposed to get over the years. Then even the primary health centers, their capitation for more than 13 months, they were not paid. They have not been paid as at the time I got it. So it was my priority to clear all these debts. It wasn't a deficit, I said a debt.
Speaking with newsmen, the chairman of the OSHA board, Dr. Muyiwa Oladimeji, affirmed that the retreat aimed to strengthen the agency's commitment to affordable healthcare in Osun State.
I therefore cannot be with you, the decent ladies and gentlemen of integrity, to whom development of Osun State is a top priority, in keeping with the desires and wishes of our governor, His Excellency, Senator Ademola Jackson within Adeleke. Last year, OIS achieved at least 2 unprecedented feats. Free registration of pensioners all over Osun State, free distribution of equipment, gadgets, and facilities to vulnerables who are Osun State indigents and their registration with OIS. These achievements are yet to be attained by any other agency in the country. As Governor Ademola Adeleke would say, we must not rest on our course. The national milieu of this era has created very challenging socio-economic circumstances that call for a lot of cerebral activities, hence another need for this retreat. I have no doubt that this retreat will achieve some milestones in the outlined direction. I wish you all good deliberations in this relaxed and friendly environment.
Also speaking, the Permanent Secretary, Ministry of Health, Dr. Isiaka Adekunle, said the retreat is an avenue for learning and to assess performance and forge ahead.
Learn some lessons and to forge ahead. It is always good to be assessing yourself, to know what you have done that is good, what is the ones that you have not performed well, and then to now strategize on how to improve yourself. This is a retreat for people to learn, not only the workers in the Osun Health Insurance Agency, but the board members too and other supporting staff. It's an avenue for learning. Look back and forge ahead, prepare for future. That's the way I look at the retreat.
In his own words, Osun State Head of Service, Mr. Anyele Yaino, advised civil servants and Osun residents to take their health seriously, describing health as everything. He assured that the government would continue to support OSHA, adding that it is now mandatory for all civil servants to enroll in the healthcare insurance scheme.
I think that's very seriously because health is everything, not only wealth, but everything. It's very serious about health. And they should make sure the community we have at OSHA will improve on their health. We are doing everything at MD levels to encourage them to enroll in this scheme. As a matter of fact, it's compulsory for them to enroll in this scheme. It's compulsory. So it's good. It's good.
Abidoye Ayobami reporting for I'm Loaded.